Welcome to Beyond the Paper Gown. I'm Dr. Mitzi Crockover. Today, we're diving into a topic that touches the lives of countless women navigating midlife. So let me ask you, have you been experiencing hot flashes, mood swings, changes in your skin and hair, or even challenges in your intimate life? And are you wondering where to find reliable information or a healthcare provider who understands and can recommend solutions? Well, our guest today, Claire Gill, faced these same questions, and she took a remarkable step forward by establishing the National Menopause Foundation. This foundation focuses on supporting women seeking to understand the myriad changes that come with midlife, from finding help to successfully managing the transition at work. And in her dual role as CEO of the Bone Health and Osteoporosis Foundation, Claire also tackles the critical aspect of bone health, including its connection of osteoporosis to many women's menopause journey. We'll explore how these incredible organizations educate consumers, healthcare providers, and policymakers about this phase of life. We'll also talk about the importance of education, programs, and policy in addressing menopause and osteoporosis challenges. I am so glad you're here as we discuss how to make the most of these services offered by these organizations and what steps you can take to advocate for yourself, be it in your doctor's office or on Capitol Hill. And just a reminder that this podcast is for informational purposes only. Please consult your healthcare provider for any personal issues you may have. However, I encourage you to share this information with your healthcare provider so that you can have a robust conversation focused on your own healthcare needs. I am very happy and excited to welcome our guest today. You're going to get kind of a twofer. We're going to certainly talk about menopause, but we also are going to slide right into talking about osteoporosis. Let me welcome Claire Gill. Claire, please go ahead and introduce yourself.
Hi, so nice to be here. I'm Claire Gill. I'm the founder and president of the National Menopause Foundation, and I'm also the CEO of the Bone Health and Osteoporosis Foundation.
Wow, those are two big hats. So let's talk about the Menopause Foundation first, and then we'll talk a little bit more about the Osteoporosis Foundation later on. And so how did you come to found the Menopause Foundation?
Yeah, so it was very interesting, and it's really very by happenstance that this came to my attention as far as a real need in the nonprofit space. So I've been working my background is actually marketing, public relations, and I have done that for more than 20 years in nonprofit and for-profit companies. And I was working in a nonprofit in the health space when it became to my attention that there was no patient advocacy education organization dedicated to menopause. And I was at the life stage where I was perimenopausal and, interested and confused about what was happening in that stage of life myself. And so did a little more background checking and worked with some of my close medical advisors and decided that this was a real gap and a real need. And so at the end of 2019, we launched the National Menopause Foundation. And we've been really, really pleased to see that menopause is getting much more awareness and attention these days in just a few short years.
What does the foundation do? What are some of its programs and activities?
Yeah, well, our mission as we launched the organization was be a trusted and relatable resource to raise awareness and understanding of menopause through education, activism, and community building. So all of our activities really center on those three areas. And basically, we wanted to start with the education, providing a place where anyone can go to get information about menopause and the journey to and through menopause. And that website is thenationalmenopausefoundation.org. From there, we also have a podcast called The Positive Pause, where we take a look at what are those topics that are most important to women as they make that journey through menopause, and interview experts around the symptoms of menopause, but also empowering women to explore this stage of life in a very positive way. We also have a newsletter, and we worked with several partners to come up with different types of programs that we felt were of most need, and that could make the most difference for women as we try to improve women's health at midlife. So we last year partnered with Bank of America on a menopause in the workplace study. It's called Breaking the Stigma, and it looked at what both employers and employees felt and experienced about menopause, and where, again, were the gaps in what the people's knowledge were about menopause, and also getting at what women's needs were to feel more secure and more appreciated and more understood in the workplace during this time of life. And then from there, we created tools and resources that both women and employers can use to be able to have the conversation within the workplace about menopause. And then again, just a natural stage of life, but one that does come with complications that people need to be aware of. And so we were pleased to do that. We also just launched the Women's Midlife Health Policy Institute, and we'll be doing a Women's Health Summit in March of this year, bringing together leaders in clinical area, in business area, and in the policy area to talk through not just menopause, but all of women's midlife health, and how can we advance it by collaborating and working together on a real agenda for what it's going to take to improve women's midlife health. So those are some of the things that we've been working on lately.
Wow, those are terrific. And it really speaks to my heart, because one of the things that I've always wanted to focus on is the multifactorial impact of various factors that impact on women's health. And you just named a number of them. Not only, just the physiological things that are happening to our body, but also the impact at work and how that can make an impact, as well as what we do know now, maybe even in Technicolor, that policy really makes a difference in terms of how we get our health and health care and are able to be healthy.
One of the other things I just wanted to add to that when we talk about that areas is family life. We don't talk enough about the journey that women are experiencing and how that impacts the people that not only we work with, but the people, we are in our relationships. And I think that's an important aspect to talk to as well, so that women know it's very normal to have those changes happening within your family and your relationships as well.
That is so very true. Let's go back to the Bank of America study. What were some of the headlines?
The headlines were really that what the employer felt they were doing to support women at midlife was far exceeded what the women and the employees were experiencing. Only 8%, I think, of women said that they felt comfortable or able to talk about menopause within their workspace. And I think something like 30 to 40% of employers said they had support for women at midlife. And so, again, just that differing of where the two sides were on the comfortableness, the culture to talk about menopause and menopausal symptoms was very, very different. So I think that was really the biggest headline for us, is that it's far off. And then a lot of the rest of the insights from the study focused on what women wanted as far as support within the workspace. And I think the good news is that there are things that we can take advantage of that companies are doing, but that menopause is not named as one of the reasons you can benefit from one of those accommodations that are already in place. So when we think now about telework, or flexible hours, those things have become a little bit more mainstream in our COVID, post-COVID, mid-COVID, wherever we are, lives. And so, but it's not known that, or stated that, if you are experiencing, symptoms of menopause, you are allowed to benefit from those accommodations that are already in place in many workforces. So really, it's more of a raising awareness and education within businesses about the needs of women at menopause, and again, fostering a culture where they feel confident to be able to mention menopause and to not have that negatively impact them based on, again, well, if you're talking about menopause, we can get a general gauge of your age, again, unless it's surgically induced or surgically required menopause, then that's something that women are concerned about these days. So we have that twofold thing. It's a health issue, but it's also an age issue.
Well, but it's really interesting when you say that, because when the symptoms are more problematic, it's really perimenopause.
That's right.
And that can start as early as, it can start earlier than 40, but, around 40 plus. So you're really not that old, But I do resonate with your comment that there is ageism, because we don't think anything, for example, of seeing a 70-year-old male executive, but we're not really seeing the same with respect to women. But
Right.
that's
Or president
a
of
whole
the
other
United
topic.
States in their 70s and 80s.
Exactly.
Like you said, that's very normal. And there's just no way that a woman would be considered, for those positions at that age. So you're right, that is it. And you're right, too, about when the menopausal symptoms start. And as we have changed a little bit, if you think about the demographics of our society, and even some of the societal trends where women are having children later in life, rather than the 20s, it's 30s. For me and many others, it was early 40s. And then
Me too, right.
you immediately go into perimenopause. It's very confusing. It's like, I
Exactly.
just had a baby and
Thank
now you're
you.
telling me I'm perimenopausal. So there, like you said, we don't feel or think that we're old, but when those symptoms start, and even at 45, as we say, well, that's not old. But if you're starting to exhibit symptoms of menopause, then there is the ageism attached to that, oh, she's reacting to that, and this is, what's happening. And so we have a lot to tackle just from a societal point, because again,
Sure.
it's a healthy, perfect stage of life. If it's basically saying that we're living long enough to experience this stage of life, which is, really amazing when you think that, how far we've come as far as extending the lifespan of people these days. That's all good news. And we just need to make sure that these medical questions that come up and the things that we're experiencing kind of catch up with where we're going.
Sure. And to your point, I too had my second child in my 40s, and I was having all of these symptoms that I assumed were part of the postpartum period. And I'm a women's health expert,
Yes.
quote unquote. But when you're in the midst of it, you just don't know that. So I would assume that even just increasing awareness in the workplace for women to know that, they're not going crazy, they can manage this. And so what comes up, though, is that women say, I don't want to be the one that raises my hand and talks about this to my employer. So what are your suggestions? And I know that you said you had some tools from this study about how women can advocate for themselves without kind of putting themselves on the line.
Well, that's a very important point. And that was the other thing that came out of the Bank of America study we did, the Breaking the Stigma study, is that it can't be incumbent on the woman to initiate this conversation. It really needs to be a thing that the corporate, workforce puts into place and then allows that conversation to happen. So that was really stressful too, because like you said, no woman's going to jeopardize her job or her position by raising her hand and saying, "Oh, I'm, having a hot flash. I need to step out of the room right now." We need to have that already in place where women feel comfortable to be able to make adjustments as needed. So that was one of the things, and the tools in place are. There's several things that are coming out, which is terrific, because thankfully we are no longer the only nonprofit in the menopause space, and not the only nonprofit in women's health who are talking about menopause as part of overall women's health. So the Bank of America and the National Menopause Foundation did create a sort of guide for the managers and the women to talk about how to initiate the conversation, and that's available for you to download. We also created for women a symptoms checklist, a menopause symptom checklist. And I know we'll talk a little bit more about what some of those symptoms are, but
Sure.
when we think about it again, and as a society, and what's joked about are those hot flashes, right? Oh, women are experiencing the hot flash, but there are so many symptoms of menopause. And
Yes.
we focused on 34 of the common, but in a format that we can track what symptoms we're experiencing, the duration of the symptoms, and the intensity, and to use that to have a conversation with our healthcare providers about what we're experiencing. And I know we've been focusing on workforce, but the other big education area is with healthcare providers. There are far too
yes.
few experts who know how to treat women at menopause. Women are experiencing these symptoms and they bring it up to their doctor and then they're dismissed. Either you're too young for this to be happening because perhaps you are in your early 40s and the doctors aren't aware about how early some of these symptoms can happen, or it's just menopause and they're sent on their way without any discussion about how to treat the symptoms of menopause. Some of it can be very severe and very debilitating, unfortunately, for women. Other women have no bad experience with it. So it really is a very personal and individual thing. And so we need to provide these tools for women, again, track what's happening in your body and as these changes are happening, and then being able to take that to your healthcare provider.
That's terrific. And we will have links to all the resources that you're talking about in our podcast notes. So thank you for that. Before we leave the workforce issue, what would be the argument for the bottom line benefit for these employers, even if they, over and above, it's the right thing to do?
Yes. Unfortunately, in our society, it's the right thing to do is not the impetus that we need. So there is always that economic aspect to business. So it's twofold. One is we do have plenty of data that shows the loss of productivity that businesses are left with when women in the workforce are experiencing menopausal symptoms. And I sort of have a love-hate relationship with those statistics because what we need, in addition to what the loss is that happens when women are experiencing the menopausal journey, what we don't have in data is what we bring to businesses at this stage of life. And I think we need both of those to make an accurate comparison as to why businesses should pay attention to women at midlife. Again, when we say the average age of a woman entering menopause is 51 in the United States, but those symptoms begin much earlier. And we're really, and oftentimes at the height of our careers then. So the capacity that we bring to our employers as far as our knowledge, our expertise, the ability to make decisions, to be able to perform in a timely manner, the ability to manage, we need to quantify those, because what we've done is started with, women are missing this many days of work due to these symptoms, and in some statistics are up to 30% of women leave the workforce at this stage of life. And many will then say it was due to symptoms of menopause and not feeling capable of being able to perform at the level that they were performing at because of the symptoms. And so we need that balance. So right now we do have you're losing some of your best employees because they're leaving the workforce and you have to replace them and retrain them, et cetera. So retention of employees, retention of some of our best and most capable employees is really the bottom line incentive, I think, for most companies to consider addressing this, in addition to it's the right thing to do.
I want to underline the importance also that I'm sure that you're addressing, and that is not just to educate women, but certainly all the people around them. And because I do think that if everyone understands what the issues are, then it makes it a lot easier. I'm going to add a little addendum because I had a guest on from the UK who has a menopause education program. She goes into the schools and teaches kids about menopause. And it was a light for me that says, I have two girls in their 20s. I didn't even think about talking to them about menopause. Shame on me. So I think to the extent that we can increase everyone's awareness, it's valuable.
You brought up an interesting point about education in schools and such, and it's absolutely true. And I talk about this all the time. We learn about puberty and we learn about reproduction in school. And yet
Kind
that's where
of.
it stops. There's no conversation.
We don't even do that very well, right?
Right, but there's basic education, and
Yes.
I share this
Most
often. So again, a later in life mom, as we're called. My daughter is only 12 now, and last year in 6th grade they were learning about puberty, and so she raised her hand in class and said, "And at the end, it's menopause, and this is what
Oh,
happens."
God bless her. All
Well, that's
right.
great. Like we said, one school, but why isn't that part of the curriculum, right? To be able to discuss the full life spectrum. And that, again, if we want to, we could do a whole nother podcast about, oh, women's value ends when our reproductive years ends, and therefore why teach people about what comes at the end. I do think we will get to that stage, but sometimes it's overwhelming, Mitzi, I have to say, because I think there's just basic education that women who are experiencing menopause need to get right now about what's happening to our bodies that we don't know about. So I sort of feel like that's the immediate audience. And then clinical providers, so that if they do figure out, oh, this is what's happening to me, and this one, they can go to a clinical provider who doesn't tell them, I won't prescribe hormone replacement therapy or menopause therapy because of a study that has long been corrected, the Women's Health Initiative, about the risks of HRT. And then there's, again, the workforce issue that we have to address for the women who are currently experiencing it. So I feel like we're in stages, right? The good news is we have now attention with even celebrities on Capitol Hill and celebrities on television talking about the fact that they've gone through this journey and they didn't know, and why don't we know, and asking all the same questions that we're talking about. And then that's important. That needs to be the general awareness. But it's still a bubble, right? There's still only certain levels of women in our country who are having this conversation. And we need to make sure that there's access to that information for all women. And I said the same thing about our Bank of America study. I love that we did the study. It was so important, and we're learning so much, and we're hopefully going to take some really positive steps to continue to work to change that. But that's really only talking about women in offices, right? We're not addressing hourly wages or the hospitality industry or, all of those other women who are working, moms at home, all of that needs to be addressed as well. So while, we pat ourselves on the back for coming forward and having these advanced studies and working on these guides for the workforce, which is incredibly important, there's still so much work to do, even within that space. And so I think it'll be a while, honestly, before we turn our attention to getting menopause added to the curriculum of every health program and grade school, across the country. But we will get there.
And how are you addressing getting education to making it more accessible to women?
Well, we right now are working on a self-directed learning program that women can get at their convenience about the symptoms of menopause, because great information available, on our website and on other websites, and there's great webinars happening, but many of the women that we talk to, and I know even how I like to learn, is a little bit more of a deeper dive into, well, why is this happening to my body? And, well, what is the research that shows that this is the right treatment, et cetera? And so we're creating that curriculum in self-directed learning modules. We're going to have 4 initial modules. We're going to work through all the symptoms of menopause that we focus on in the checklist, but the first 4 are our basic Menopause 101, vasomotor symptoms, which our technical clinical term, which just means hot flashes and night sweats. Those are the symptoms that we call vasomotor symptoms. Sleep disruption, which is another big one for as far as the number of people who experience that symptom going through menopause. And then things that have to do with the pelvic floor. and the things that we experience as far as urinary infections, vaginal dryness, sexual health issues, all of the things that we don't talk about and don't help women understand. So those will be the first 4 modules that we will launch hopefully at the end of the first quarter of this year. And then we'll again start building onto all of the others. And as I said, the basic information is available on our website, but those modules will be available. And we're also partnering with other companies to do local tours, local events that will be particularly focused on democratizing menopause and making the information available in communities and in places that we're not normally having these conversations. So we want to go to churches and community centers and, areas that any woman can access to find out information about her journey. What's also really interesting about women and our uniqueness and our power is the menopausal symptoms actually differ depending on our ethnicity. And so that's
You just read my mind. That was my next question.
Yeah, that's something really important for people to understand. And so again, it's really important to speak to people within their community from people they trust and provide access to local experts that they can follow up with. I've been to some fantastic events. And again, I'm so excited that this is becoming something that is more mainstream and that there are these events happening, both, like I said, either celebrity companies that are now producing events or other great nonprofits we work with are presenting events. But, again, they think there's a cost associated with them and, a time commitment, like, again, having it during the middle of the day.
Sure.
So that, again, is accessible to certain women, but not all. And so we're trying to work with and focus on partnerships where we can get into the community and provide either free or very low cost events where, again, local experts are made available to help women. And so we're hoping to be launching that tour this year. And so lots of really important things happening. And I know it's like, well, they should have been going on for years. But remember, we had the pandemic. We were all indoors for a number of years. And so we're now just able to take this from a virtual setting into live settings around the country.
That's very exciting. You also mentioned that you do some policy work. I'm very interested in that.
Yes. So again, one of those gaps that we saw strategically as we thought through what do we need to do to advance women's health, and particularly at midlife, was this need to both do top down and bottom up. That's what I call it. You need the grassroots effort from women demanding that there be attention paid to midlife women's health. But then you also have to start with the federal agencies and Congress and making sure that they're aware and that they too are advancing some of these. So the good news there, lots of activity happening as well. There are several members of Congress who are enacting and putting forward legislation to address the menopausal journey, and both from a research aspect, but also from a access to care. The other big thing is we have treatments available. Many of them are generic that women have access to, that should have access to, and yet they aren't getting access to. And it's a very complicated situation for why that's happening. As I mentioned earlier, a lot of people are, even clinicians are still confused about hormone replacement therapy. And I should probably say what that confusion is, just for those listening that may not be aware. But the Women's Health Initiative, which was so fantastic and is fantastic and continues to this day, was the first real federally funded study that looked at women's health. And a fascinating fact for me is that it was only 30 years ago, last year, where it was federally mandated that women be included in clinical trials. Prior to that, just for all of us to know, studies were done on men, and then they just applied it to women. Because
mostly white men.
Yeah, we were too complicated to study, too expensive to be involved in it. So really, it was only 30 years ago that it was federally mandated that in any federal research, women be included in the clinical trials. So the Women's Health Initiative obviously then was another giant step forward, where it was looking at and tracking longitudinally, long-term women's women's health. What happened then was, when they were looking at hormone replacement therapy, some big headlines came up, and it said, that women on hormone replacement therapy had an increased risk of breast cancer and heart disease, of two of many. And those were the headlines. And for those of you who are my age or who are at midlife or beyond, you probably remember the big discussion about it. And then again, everyone went off hormone replacement therapy because
Oh, we stopped prescribing it. And I just, and then I started feeling guilty.
exactly, it was just a cold, hard stop.
Yeah.
The good news on that is, again, the study continues and then we learn more. And now they have come forward and made people aware that, oh, there was a flaw in that study when the announcement or the outcome of it, when they said, that hormone replacement therapy was a risk, that was looking at women who were on hormone replacement therapy like in their mid-60s and beyond. Well, for those of us who would be starting hormone replacement therapy at the onset of menopause, like in the symptom time, perimenopause, menopause, there was no increased risk of either of those diseases. So as you said, we stopped cold turkey, and that whole generation of women suffered through those symptoms and, like you said, lost bone density, other things that we would have benefited from had they been on hormone replacement therapy. And now we know that this is the case, but the problem is there's no big headlines. There's no giant campaign telling people, hey, we now know this from the study. So you'll find both women and many clinicians still will not consider taking any type of hormone replacement therapy because of the risks that were associated with that study, which we now know were not related to women actually entering menopause. So that, again, when we talk about policy stuff and things, yes, policy is one aspect of it, but it is not the only reason that women aren't accessing the treatments that are readily available and effective. We have a lot of work to do, again, on those educations. But back to the policy, just even having women's midlife health and menopause be mentioned in legislation is super important. And one of the ones that we were very pleased to be part of with another nonprofit that is focused on menopause called Let's Talk Menopause, we partnered to help bring forward a Menopause Research and Equity Act that two female congresswomen brought forward. Yvette Clarke in New York was the spearheader of this legislation. And there are many, many co-sponsors. And again, with this podcast, you can get access to the legislation and who's involved. And that basically said, directing the National Institute of Health to direct some of their funding towards studying research gaps for women in menopause. And that's really, really important. Since then, there are several more members of Congress who have put together very interesting, very in-depth legislation that is also looking at other areas, workplace, access, et cetera, in addition to research that is so important. And so all of that is very good news, and we're going to kind of continue to follow that and see where that goes. But part of the impetus of starting the Women's Midlife Health Policy Institute was to bring together all of the organizations and stakeholders focused on women's health at midlife across the board, not just menopause, but heart disease, bone, cancer, diabetes, fibroids. There's so many things that change and have an impact on us as we, journey through midlife. But that collaboration portion is really key when it comes to making a difference. The whole "we're stronger together," kind of motto is really what's meant for that.
Absolutely. If an individual is listening today and they say, God, I want to do something, how can I help push this forward? What would you suggest to them in terms of some of this legislation? Should they get in touch with their congressperson?
Yes. And there's several ways to get involved in general in supporting and educating about menopause across the board. On the legislative side, absolutely. Get to know your members of Congress offices. Call them. I'm just outside Washington, D.C. I do spend a lot of time doing education, programs on the Hill. And I'm told by all of the staff, they prioritize what they're focused on based on their constituents' interest and outreach. So we need to be calling our members of Congress, getting on their list that they know, oh, Claire Gill is called again, and she wants us to focus on this particular legislation again. It really matters. I mean, I can bring all the best experts to Washington and to sit with them, and I do. But obviously, the way Congress works is they are responsive to their voters. And so your power as a constituent from, Des Moines to your senator and to your member of Congress is far more influential than mine going to your member of Congress and Senate, right? So yes, to do that. Again, I mentioned Let's Talk Menopause, our colleagues in New York. They actually, if you go to their website, we have a sign-up sheet where you can be involved and it'll help direct you and let you directly contact your member of Congress from their website. But you can just Google your member of Congress and get both their district office information and their Washington, D.C. office information. And I would say email and call and just let them know, get on their radar and say, hey, I'm a woman in your district and I vote and this is what's, important to me. Getting involved in other things too is really important. We are work often with medical education and training programs for healthcare professionals where they want the patient voice. They want the woman's voice to be included in that training. And we tap into the women that are part of our network, and they volunteer or not. It's actually sometimes a paid option where they become involved in sharing their story to help educate clinicians. So again, having that younger woman who said, I went through 5 years of suffering with these things because no doctor even mentioned to me that could be menopausal. I was checked for dementia. I was checked for cancer. I was checked for this and that. And then it turns out I was in perimenopause and I really just needed hormone replacement therapy. And so hearing that directly from women is super important. So they can just email info@nationalmenopausefoundation.org and express their interest in that. And we, again, sort of coordinate how to share those stories with medical providers and get involved. So like I said, lots that we can do to immediately engage and create that space for raising awareness and influencing legislation that's coming down the pike.
Terrific. When do you sleep?
Well, we don't sleep at midlife. That's one of the symptoms of midlife.
That's right. So might as well put it to work.
We can be very productive at 2:00 in the morning.
That is very true. So I want to talk a little bit because, I've been immersed in this ecosystem and there's been so much going on in the last few years, especially with menopause programs, for-profit menopause programs, services, devices, supplements, and all of that. So talk a little bit about some of the things that you're really excited about. Then also, how do consumers make sense of the quality and the effectiveness of some of these things?
That's a very, very good question. There are lots of companies now interested in this particular life stage because it's been already, like I said, on the economics, been tagged as a multi-billion-dollar potential industry. The first foray into it, where people were really being vocal about it, tended to be around skincare, which I find particularly interesting and funny, and another statement to our society, right? That's how we tackle what women are experiencing at midlife is, what do we look like? I would say skin issues are an absolute symptom, and dry skin is a symptom of menopause. And the impact that loss of estrogen has on our physiologically is just incredible. So dry skin is an issue. So you will find a lot of things out there as far as creams and moisturizers, et cetera, et cetera. It's up to you on those instances to judge for yourself whether or not you need something specific to menopause or whether the moisturizer you generally use will also help with your dry skin. So I would say just be cautious on that. The thing I'm most excited about is, and probably the least exciting for the population, though, are the therapeutics. I mean, like, as I said, the fact that we now know that hormone replacement therapy can address so many of these major debilitating symptoms that we're having, that's really exciting to me, and making more women aware of the fact that that's available. And again, because with hormone replacement therapy has been around for so long, it's almost always, genetic. And there's so many different delivery mechanisms for hormone replacement. It can be a patch, it can be, a pill, it can be a topical ointment. There's so many different ways women can get it. And then it really is up to you and your healthcare provider to choose what works for you best and what do you want to experiment with. And that's really great. But the other aspect of that is for those who really can't do hormone replacement therapy for whatever medical reasons, we now have non-hormonal solutions that are on the market. And that's really important. And one of the newest ones just got approved by the FDA last year. So really, again, there's so much need, and we just haven't had these. And the fact that hadn't been in the, that there's not tons of these options in the pipeline coming through is really, disappointing. And the fact that now we have those is really terrific. So there are one that's already done, just been approved by the FDA, and another that is, finishing its clinical trials with the FDA that are both, again, non-hormonal treatments for vasomotor symptoms. And I think, again, really exciting. As far as devices and things, again, new things coming on the market every day that can, check your temperature, regulate, your pulse, all of those kinds of things. Good and bad, right? I think it's going to be very individual. I think some women will really benefit from being able to have those tracking mechanisms that help them, detect when they're having a hot flash and, provide that opportunity to do well. I think you kind of know when you're having a hot flash, but this is more to help provide some relief as you're starting, to your body temperature is changing maybe and being aware of it. And I think some of those are interesting and useful. One of my cautions would be probiotics. There are a ton of probiotics and supplements that have are come to market and are coming to market. And the reason that happens so often is because they're not regulated by the FDA. So their process of bringing them to market is a lot quicker than it would be for something that was actually regulated by the FDA. And that means there's not the oversight that there would be of other kind of treatments that we would take. So you have to be very, very careful with that. And I would say if you're considering it, it's still important that you talk to your healthcare provider about the type of probiotic or supplement that you're considering, and what the benefits and what the risks are. I think one of the really terrific ones that, again, do no harm, but actually can do good, are sort of the wick clothing that we think about. When you're having a flap vest or a night sweat, pajamas that provide breathability, or that it's almost like the same material that we use for sports, to like take off the sweat as we're working out and stuff like that. Cooling sheets, all of cooling pillows, cases, those kinds of things that I think were never around or never considered before. Right. And the fact that those are available to women, should they need them, should they be in a position to be able to get them, are things worth considering.
Sure. And also, I think another area that has come into its own, perhaps, is sexual health. And so, again, with a lot of menopausal symptoms include what you talked about earlier, genital urinary, and let's just call it vaginal dryness.
Yep. But, when we think about it, lube has been on the market for decades, right? And so do we need something specific to menopausal vaginal dryness? Not so sure, right? Maybe you do. And if you want to do that, that's terrific. But also, again, the fact that we don't have that sexual health education for women anyway, and men, and talk about what that is and the importance of that. And it's interesting because I would say of all the events I go to, there's probably at least 3 of the sessions about sexual health as a symptom. And it's interesting to have that being discussed, because you couldn't say the word vagina. You still can't say the word vagina on television and in other areas in many cases. And so the fact that we're talking about women's sexual health and pleasure and what that means and how important that is to our overall health and well-being is really fantastic. And I think that's a great advancement, and we need more of it as we have this conversation about what does midlife health mean?
And going to your point about policy, and I hear this from entrepreneurs all the time, especially in the sexual health area, but even in just menopausal area as well, when they're addressing vaginal dryness, is that they get censored on social media. So they can't even get their products out, can't get the education to women.
There are things that are really, like you said, really important to health from the sexual health aspect of it and the benefits of it, and that it should be something that is considered as part of the what does healthy aging mean? Healthy aging also includes sexual health and being able to explore that part of our our journey and our needs is really important. And as you said, yes, there's barriers put up everywhere on social media, on television, as I said, on things that you can't do and can't say. And so it was exciting to see a menopause as a Super Bowl commercial, thanks to one of the newer non-hormonal replacement companies talking about it. That's a big stride, right? That's a positive that was happening. And so we just need to make that more mainstream. And I think that's really part of, again, what I hope our purpose and our journey will be at the National Menopause Foundation is by the time my daughter is approaching this stage of life, it should be something that she completely understands and can get access to the care she needs, and clinicians know how to address whatever symptoms she might be experiencing. I want that for all women and all people who are experiencing menopausal symptoms.
So, shifting topics, because I want to talk about your second hat, and that is as the executive director of the Bone Health and Osteoporosis Foundation. Did I get that name correct?
Did.
Because I know you changed the name.
Yeah, we did. We changed the name. We rebranded in 2021. We were the National Osteoporosis Foundation. And when I took over as CEO, although I'd been with the organization for 10 years, when I came on as CEO, one of the things, again, given my marketing and PR background, was to look at what we've been doing over the past 30 years at the time, 30 plus years, and what people thought of us in the landscape. And it was really interesting to, do the research and dive into all of this opinions and of all of our stakeholders, including people who did not know of our organization or what we did. And everybody wanted to keep osteoporosis in the name. The feedback we got was they wanted prevention and bone health to be discussed as much as we discuss managing the disease of osteoporosis. And so that's how we became the Bone Health and Osteoporosis Foundation.
So talk a little bit about what BHOF does and its mission.
So BHOF is the nation's leading patient advocacy education organization in bone and osteoporosis in the U.S. And we're a hybrid organization in that we are not only the leading patient education organization, but we also provide continuing medical education for healthcare providers about bone and osteoporosis. And so those are our two areas of focus, as well as policy. We also run the National Bone Health Policy Institute, again, knowing that that's the third leg of the stool in what we need to do to make sure we're advancing bone health in America. So when we talk about the connection between menopause and osteoporosis, it's that when we go through menopause and postmenopausal, women can lose up to 20% of our bone density in the first 5 to 7 years postmenopause. So one of the things we truly are at greatest risk for as we approach menopause is osteoporosis. And I think that's something that so many women who have osteoporosis say to me as a CEO of BHOF, why didn't I know? Why didn't someone tell me when, at menopause that I needed to change my diet and get more calcium and vitamin D and work on these weight-bearing exercises and do all of these things? And we all had that same question too. Why don't we, Currently, you can get a bone density scan as a woman at age 65. Once you're on Medicare, it's free to all people on Medicare. And that's terrific. But by 65, you are likely, either already osteoporotic or at a much higher risk for osteoporosis. And so we are working to change some of the ways that we address screening for osteoporosis and bone health. On the policy side, lots of people need to be involved in saying you need to pay attention to, bone health and osteoporosis and fractures to their members of Congress. But those are the things that we're working on. That's what the organization does. I feel like there's so many connections between that and menopause. Again, the basic education and awareness about how our bone and structural, our skeletal health works. Something that many of our clinical experts have said was that osteoporosis is a pediatric disease that manifests as we age, because we build the densest, strongest bone we're going to get by the time we're in our mid-20s.
And that's why we need to tell kids that, even though they may or may not listen, because if you miss it by 30,
then you're already deficient. And then the body, it's a living tissue that remodels throughout our lives. So I think people know, like, your skin, you slot the skin, you get new skin, it regenerates. So do our bones. And that remodeling process is healthy and happens throughout our life. It does slow down a little bit as we age, so we don't build bone as fast as we make bone. And so sometimes that is why people think,
Right.
It's just a normal part of aging. No, that's minor. It is much more impacted by people who have both controllable and uncontrollable risk factors. And so, like you said, really important to pay attention to. If you're, in a life stage where you have grandchildren, your grandchildren need to be getting calcium, and they need to be doing weight-bearing exercise, jumping, running, all the things that we did, before we got on computers and just played on iPads or games and stuff.
Absolutely.
They need to do that to be that. And then again, we build throughout their lifespan, and then bringing it back to our menopause discussion, the reason people think bone and osteoporosis is a women's disease is because it happens more rapidly and more frequently to women due to the loss of estrogen at menopause. For men, it's absolutely a men's condition as well. It just happens a little bit later in life because they don't have a huge drop-off in progesterone the way we do of estrogen. And so those are the kinds of things that we need to pay attention to. And another reason why, again, I think the collaborative look at women's health is so important, because all of these things play on one another. If women were getting the estrogen they needed at the onset of menopause, they would be continuing to build their bone strength and maintain their bone strength for a lot longer than we currently have it, because women aren't taking any estrogen replacement. And so it really is important that we work together to figure out how do we advance all women's health at midlife and make sure women are aware of all of these different conditions that play such an important role in active, healthy aging. And then there's other things too, as far as what we know is good for our overall health. And I say this too, I need to practice what I preach, but exercise, movement, healthy eating, all of those things play such an important role in our health and adjusting to every stage of life, including menopause. They really, really have to pay attention to it. And I think if we do those things, there are many, many ways that we can address the menopausal symptoms that we're having. It doesn't mean it's going to clear them up entirely, but it will help you manage it. And that's what it's all about, right? Being productive and healthy and living through it and being able to manage whatever it is you're experiencing. So I would encourage women to first look at all of those habits, those healthy habits, things that we maybe have let slack, or that we just, like me, need to put into practice, and do those things. And then again, if there's, continuing of symptoms that are just really debilitating, to please seek out experts who can help you to address them. Because there's no prize for suffering, and there's no need to suffer.
So as we're wrapping up, what did I not ask you that you wanted to make sure our listeners were aware of?
Well, we covered a lot. And as I said, we could probably do several more, obviously, on these topics. So I would say there's nothing that you didn't ask. I would just like to reinforce for women that, menopause is a natural stage of life. It is not something to be embarrassed or shamed by. regardless of what our society tells us about aging, it is a spectacular time of life. And you will hear more and more from women talking about, which I love to see. And I've just was watching so many influencers and celebrities talking about, man, how great they feel at this stage of life. I think Jodie Foster just did it. Michelle Obama just did it really recently, talking about this is an amazing life stage. And so try to keep that in mind as you approach this stage of life, that it is, again, there are so many positives that come with it, in addition to the symptoms that we keep talking about. And then, again, to try to find a trusted healthcare advisor who is, really will listen to you about your symptoms and help you address them if you are suffering. Again, there's no need to suffer. And becoming aware in general of what's happening to your body at this stage of life. And again, on our website, you can see those symptoms checklist and know that you're not alone. We didn't cover so many of the things that, women talk about when we talk about brain fog or anxiety and depression, where you've never had it in your life. You're not that type, you've never been an anxious or a depressed person. And all of a sudden you're having these feelings and wondering, what's happening to me? And all that's happening is you're going through the next life stage. So I think just knowing what to expect, knowledge is power, right? We talk about that all the time in so many things. And it's the same with this. Learn to know your body and what's different in your body, and then being able to address that. And I hope women will reach out for all of the great resources that are available to help them with their journey.
Well, Claire Gill, who is CEO and founder of the National Menopause Foundation, as well as the executive director of the Bone Health and Osteoporosis Foundation, I can't thank you enough for this conversation, as well as what you're doing for women.
Thank you so much for covering this topic. I'm so delighted to have been here.
The transition to menopause can be a significant change for a woman. But as you heard from Claire Gill today, it is not all doom and gloom. It can be a wonderful new phase of life with many possibilities. The challenge for all of us is to manage our symptoms so that they don't get in the way of our enjoyment. And that means finding solutions and recommendations through our healthcare providers and through other resources such as the National Menopause Foundation and the Bone Health and Osteoporosis Foundation. I encourage you to check out both of these organizations and the resources we provided you in the podcast notes. You can also check out our website at beyondthepapergown.com for articles and other resources. And while you're there, please subscribe to our newsletter. We not only alert you to our latest podcast, but you'll also find information on resources, articles, events, and news focused on the health of women. You can also tell us what topics you want to hear about next by sending an email to info@womencentered.com or just ping us on the website. Thank you for joining me today, and please take good care. Our episode was produced by Patrick Shambayati and myself, and our associate producer is Kyla McMillian.